Hi, I'm Shelley and I'm a consultant midwife here in Powys.
And I'm Tom, a paramedic with the Welsh Ambulance Service, and I'm the clinical lead for the Powys area.
So if you're planning to or thinking about giving birth at home or in a freestanding midwifery unit or birth centre, you might be wondering what would happen if you needed to be transferred either during your labour or shortly after birth. Transfers can and do happen, but they're managed calmly, professionally, and to get you to the nearest unit as safely as possible.
Our ambulance crews across Wales take part in maternity transfers every day, and in this video we're going to talk about what that journey will look like.
So there are several reasons why we might need to transfer you to an obstetric unit or hospital during your labour or shortly after birth. It could be that your labour is taking a little bit longer than expected, it might be that you want an epidural or additional pain relief, or it might be something in yours or your baby's observations that mean that we would want a doctor to review you. In Powys, we monitor our transfers closely. We review every case of a transfer that happens, and we also monitor our rates carefully. And that's so that we can share information with you to help you make an informed decision about where to have your baby. On an annual basis, we publish a poster, and on that poster it has information about how many births have taken place in the health board, how many people have needed to be transferred, and what the outcomes of those have been. Your midwife will be able to discuss that data with you in detail, and that will give you the most up-to-date information to help you choose where to have your baby.
Exactly. It's important to remember that a transfer doesn't always mean an emergency. Most of the time, it's about providing the right care at the right time for you and your baby.
In fact, our rates indicate that a truly life-threatening emergency is incredibly rare. And in those situations, should they ever arise, the midwives and ambulance crews are fully trained to manage them effectively together to keep you and your baby safe. So if we feel that a transfer might be the best option for you, we would always discuss that with you in terms of why we would be recommending the transfer, where we would be going to, and what the situation is, so that you can make a decision about what's best to do at that time. We will assess the most appropriate way to take you to the hospital, so whether that's in an ambulance, whether that's in a taxi with a midwife escort, or whether there's a circumstance that it might be appropriate for you to travel in your own car with a family member. If it's felt that an ambulance would be the most appropriate way to transfer you to hospital, we will call 999 and arrange that transfer, and the midwife will continue to provide your care. So families will often tell us how calm and reassuring the crew were when they arrived. As maternity and ambulance services, we're used to working together a lot. We train together annually in how to manage emergency situations should they arise. And we will often find that the crew that come will already know the midwives, and we will have worked together or at least met each other before.
We know that it's an important point in your birth journey, and we will make sure that we always introduce ourselves, explain what we're doing, and check in with how you are feeling. You're still in control, and we work around you, your comfort, and your choices. Ambulance crews will ask about your labour and how it is progressing. They will also ask about how you and your baby are doing, and whether or not there are any concerns that we need to be aware of. That way, when we arrive, we will understand the situation quickly and can step into your birth space respectfully and confidently. We understand that it might be frightening and distressing to have an ambulance called for you, and that this was not in your birth plan. But we will look after you, and we will be happy to answer any questions that you or your birth partner may have. Ambulance crews will bring bags and equipment with them, which enables them to provide care and treatment quickly if needed. Please do not be alarmed by the number of bags that we may bring with us. This is completely normal practice. Sometimes a solo paramedic in a car may be dispatched and arrive first. They will be there to assess your needs and start treatment if required. Don't worry, an ambulance is also going to be sent too. You should expect the ambulance crew to have a clinical discussion with your midwife when they arrive, so that we have current information about you and your baby's condition.
So before we travel, we will work together as a maternity and ambulance team to make sure that everything is safe for the journey.
That's right. We'll check things like your pulse, your blood pressure, your breathing, and your temperature, and how frequently your contractions are coming. We will also ask about your pain levels and how you are feeling overall.
And as midwives, we will update the team on things like your baby's heart rate, if that's applicable, your progress in labour, and any other key clinical information that will help us put your care plan together.
All of that helps us to plan the safest and smoothest journey for you and your baby.
So in terms of the actual transfer and the journey when it comes to that, what type of support can the crew offer?
Yeah, so there's lots of things that we can provide in the ambulance. We can provide oxygen if needed. We can help to ensure that you're comfortable and offer certain types of pain relief which are safe to use during your transfer. We are fully prepared if your baby decides not to wait to be born until we get to hospital too. The paramedic or midwife may want to insert an IV cannula. This is so that we can provide you medications and fluids if needed. Our clinicians are all trained in dealing with maternal emergencies, and we can support your midwife with your care.
So in terms of a transfer in an ambulance, a midwife will always travel with you, and your partner can almost always come in the ambulance too, though we often find partners travel separately because they need a means of transport to be able to get home. Throughout the journey, we'll keep checking in with you, so the ambulance crew and the midwives together will be making sure that you're comfortable as possible, and if we need to administer any medication or provide any treatment, we'll do that collectively together.
The team looking after you will decide whether it's appropriate to use the blue lights and sirens during the transfer. There are lots of reasons why we may choose to use them, including the traffic conditions and the progression of your labour. It may not always be necessary to use the blue lights and sirens for every transfer. However, it is important to note that just because your transfer is in by an ambulance and that we are using the blue lights and sirens, it doesn't necessarily mean that it's a life-threatening condition for you or your baby. Mainly, it's about being able to provide continuous, seamless care quickly in a timely manner.
So should we talk through the scenario that potentially the baby is born at home or in a birth centre, and we may then need to do a transfer to hospital. And this is a scenario that does happen. So what do we do in terms of transporting mum and baby if that's needed?
Yeah, so that's a really great question, Shelley. And it's very dependent on whether or not the baby or the mother is considered the patient in relation to this transfer. The most important thing to us is that everyone in our care is safe, and that the Welsh Ambulance Service does have a policy for this very situation. If the baby is considered the patient, then it's important that our crews can adequately monitor and treat them. This can only be done safely and effectively when the baby is on the stretcher of the ambulance. To do this, we will use a special neonate harness so that the baby is strapped in tight and will be looked after with our expert care provided by our clinicians. A parent or a caregiver can accompany the baby in the ambulance too, normally. If the mother and the baby are both considered patients, then it will require 2 ambulances to facilitate this journey, 1 for each of the patients. If the baby is considered to be well and the mother is the patient, then the safest and quickest way to transfer that baby to hospital so that the family are reunited quickly is for that baby to go in a car seat in the caregiver or another parent's car to hospital. However, in situations where this cannot be done for whatever reason, or it's not safe, or it can't be done in a timely manner, then we can strap a car seat into the rearmost ambulance seat in the back for the baby to travel to hospital with the mother. However, I have to stress again that this is only if the baby is not considered a patient and every member of the team is happy with the baby's condition.
It's really, really important that you remember to bring a car seat with you if you are having your baby in one of our birth centres. And that's so that you can take the baby home when everything's absolutely fine. But if you do need to transfer in, you've also got the means to take the baby in as quickly as possible. So once we get to the obstetric unit, we will hand over the care. we always go to the nearest obstetric unit or hospital. And that's so that we don't prevent any delay in your care and that we get you there in a timely and appropriate way. Going to the nearest unit might mean that you go to a hospital that's different to one that you have received care in if you have had obstetric care in your pregnancy. But we will discuss that with you in your pregnancy so that you know where your nearest transfer hospital would be if you need to have that transfer. And the reason that that is the case is because where we do the call for 999, they will always take us to that nearest unit. When we get to the obstetric unit, we will hand over to the maternity team there. We do that jointly. And that obstetric unit team will know that you're coming. We will have already run beforehand to say that we are transferring you in, and they will be ready to welcome you.
We will give them a full handover so your care continues seamlessly and without delay. We may also call them en route to hospital so that we can provide them with an update.
So a transfer is just one part of your birth plan potentially adapting and changing, and that's to keep you and your baby as safe as possible. If you've got any questions at all about the process of transfer, please discuss that with your midwife.
There will be a whole team of trained professionals supporting you every step of the way during your transfer.
And we're here for you wherever your birth journey takes you.